New videos every day.
Life, wisdom. Thank you for tuning in to The Truth Talks. I'm Corrina Rachel. We've all heard that people get more depressed in the wintertime, and that it could be due to the lack of vitamin D, which we get from exposure to the sun. So let me know, is this something you've heard of before? Is this something you've experienced before, becoming more depressed in the winter months? In this video, we're going to talk about vitamin D and its role in health and mental health. So please leave your comments and questions below. I'm joined today by Dr. Colin Ross. He is a practicing psychiatrist, author, and MD based out of Dallas, Texas. Thank you so much for joining me today.
Thank you for having me.
So vitamin D is something that is only recently been examined or is becoming more in the spotlight or in the limelight in terms of something that can affect our health, affect our mental health. What kind of research have you seen about the importance of vitamin D?
Well, I've been educating myself for a couple of years now on this subject. So when I went to medical school, late 70s into the 80s, there's these vitamins, A, B, C, D. D is one of them. You get it from milk. It helps put calcium in your bones. End of discussion. And if you don't have enough, you could get rickets. And it really was very quick brush over, and nobody worried about it. Nobody measured it. Nobody really studied about it or thought about it. And it was one of the vitamins. But we know there's something funny about it because it comes from sunlight more than your diet. And actually, technically, vitamin D is not a vitamin, it's a hormone. The definition of a hormone is it's made in one place in your body, but it has its action far away. So for instance, cortisol is made in your adrenal glands that just sit on top of your kidneys, but where it works could be far away elsewhere in the body. It circulates around in your blood. So vitamin D, if I take 5,000 units of vitamin D a day, which a lot of family doctors would say, ooh, that's more than you need. For me to get that much vitamin D from my diet, I'd have to drink 50 8-ounce glasses of orange juice a day. It's basically impossible to get enough vitamin D from your diet. The main source is sunlight. So the actual photons from your sun hit your skin. They're captured there by receptors. And then the pre-vitamin D is converted to sort of the first form of vitamin D, and that goes to your liver, goes to your kidneys, and through a couple of steps, it's made into the active form of vitamin D, which circulates around your body. And the number is growing and growing all the time. First of all, vitamin D only had to do with bones, but now we've got solid scientific research that vitamin D regulates at least several hundred genes in your body. And then the count went up to, it looks like vitamin D regulates 900 genes in your body. And now the numbers are starting to get, bigger than that. So there's vitamin D receptors in every cell in your body. And vitamin D controls and regulates countless different processes and is important in many, many, many different forms of disease, from diabetes to multiple sclerosis to how healthy your bones are to even a variety of different forms of cancer. So vitamin D does many, 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 many jobs in your body. And we're in an epidemic of low vitamin D, which the medical profession is just kind of getting tuned into. The family doctor is much more likely to measure vitamin D in 2012 than in 2002, by far. And the standard recommendations, if you look at your vitamin bottle, is going to be probably 400 units a day. 400 units a day is just enough to maybe prevent you from getting rickets. So all the guidelines and all the recommendations are set up. Your blood level should be above 20 nanograms per milliliter. And if you take 400 units, plus you get a little from your diet, that'll probably get you above 20. Your risk of rickets is 0 if you're above 20. If you're below 10, it's like really severe risk. And then in between, it's in between kind of risk. But there's one of the books that I read is literally this thick. It's like 1,100 pages. Very academic, very scientific book. If you look around the world, there's way, way low levels of vitamin D in dozens and dozens of different countries, just in the general population. In the United States, 65% of children have blood levels below 30 and 15% below 20. So below 20, every conservative medical group in the world believes that's too low. But I think that the actual proper levels are 50 to 80. And the reason I think that is, if you just go out in the sun and you get a little bit pink, if you're a white person, that's the equivalent of taking about 15,000 units by mouth. So no doctors are going, oh my God, you got out in the sun, you might be vitamin D toxic. Because all doctors know that you don't get vitamin D toxicity from suntanning. But doctors will get very, very worried if you're taking 5,000 units a day because, oh my God, you might have vitamin D toxicity. You can't get vitamin D toxicity until you're somewhere up above 40,000 units a day, every day for a long period of time, and your blood level's somewhere above 200. So the safety buffer is really big for vitamin D. Right. It's a very cheap, it's very safe, it's very over-the-counter. So we know from research that if you're out in the world, either working outdoors in the summer or 30,000 years ago, you're outdoors most of your life, your blood level is going to be in this range of 50 to 80. That's the evolutionary norm. That's what the human body is designed to need, want, and be used to. And that's the blood level you get if you take 5,000 units a day with the normal amount of sun exposure we get around here. There's one survey in England, 96% of people in England are deficient in vitamin D during the winter. 96%. And the health implications of this are, when I do a workshop on this, I've got bar graphs. So you'll see if your vitamin D level is like below 20, here's your risk of cancer. If it's above 30, here's your risk of cancer. If it's above 40, here's your risk of cancer. These are big studies published in mainstream cancer journals. Same, if you have cancer, here's your risk of dying if your vitamin D level is low. If it's in the 30s, your risk of dying from that cancer drops down dramatically. And all these studies are looking at very low levels of intake, like 400, maybe 1,000 units a day. So we need a whole bunch of research. If you bump up to 5,000 units a day, bump your blood level up to 80, it's scientifically absolutely realistic that we could be dropping our cancer rates, our multiple sclerosis rates, diabetes rates dramatically. There's a study in Finland where mothers were given 2,000 units, I think it was, per day, and then the babies were given supplementation in the first year of their life, and then they're all followed for 31 years it was. So that, and then the comparison is just people who went through life as normal, didn't get the supplementation. The rate of type 1 diabetes, that's like childhood onset, not weight-related diabetes, which is type 2. The rate of type 1 diabetes dropped 86%.
Oh my goodness.
This is published in a mainstream regular journal. So you can always say we need more research, we need more research. It looks like you can cut your risk of multiple sclerosis by 50% by taking these kind of levels. Now, a lot of doctors are going to go, whoa, wait a minute, we don't have enough proof of that. That's for two reasons they say that. One is they don't know the literature well enough, and it is true we need more research. But this is big studies with thousands of people published in mainstream journals, and all that information is just kind of soaking in to regular mainstream medicine. In the world of psychiatry, there's a small number of studies that are starting to grow now, showing that psychiatry patients in general are even lower than the general population. Right. There's one study showing, if you look at autism and schizophrenia, the average blood levels are around 12 to 14. Whereas if you look at sort of anxiety problems, mild depression, it's more up in the low 20s. So there's a little bit of evidence starting to show that maybe the more severe, more brain disease-looking forms are associated with lower levels of vitamin D, which then leads to the theory, well, wait a minute. If we did a big study with tens of thousands of mothers, and we supplemented them adequately all the way through the pregnancy, and we supplemented the kids adequately for the first 5 years, and then we followed all those people for 30 years, which is a gigantic study, what would happen to the rates of autism and schizophrenia? This is a very realistic scientific research question that isn't that hard to investigate.
Right.
And it's not just sort of this intuitive thing that you take some vitamin D and you feel better. You can't actually feel the vitamin D. It's a routine blood test to find out what your level is. So you can adjust by your blood level. And so it's not going to be like the cure-all for everything. But there's also some evidence that you would just survey a whole large number of people. The lower the vitamin D, the higher the depression levels. Not by a ton, but enough to be worth looking into.
Right. And especially since, you mentioned that in order to have vitamin D toxicity, you would need something around 40,000 units
every day for
units
a long
per
period
day
of time.
for a long period of time. So we're looking at a pretty safe drug. Or a pretty, you can't, I guess, call it a drug necessarily. It's a vitamin,
it's a supplement,
but a supplement that, you're not going to have any negative health side effects, taking, even like you mentioned, that you take 5,000 units a day, so why is there so much reluctance among the medical community to look at something that not only has been shown to have significant health improvement benefits, reducing diabetes, multiple sclerosis, cancers, all the things you mentioned, really limited side effects, negative side effects, and why is it so, why is this information kind of just now coming to the forefront when it could be so beneficial for people?
I think there's a number of reasons. If I go back to when I was in medical school, we heard about vitamins, didn't really show much interest in nutrition or health. We got a couple of lectures out of 4 years. The only exciting part was if you could put vitamins in an IV and give it to somebody IV, that was worth thinking about. And we knew vitamin K had to do with blood clotting. And we heard that some Eskimos would eat too many polar bear livers and get vitamin A toxicity, and it was very dangerous. You could die from it. So this is kind of, vitamins are dangerous idea floating around, which just got kind of transferred onto vitamin D. And there's these vague rumors that vitamin D toxicity could be a serious thing because your calcium would go too high, then your heart wouldn't work right, and your parathyroid. It wasn't actually based on any facts. It was just kind of this nebulous concern. And then there was no counter teaching. And then it just becomes kind of habit and tradition. My teachers never said anything about it, and they were kind of concerned about vitamin D toxicity. And so you just absorb it from the culture of medicine. And doctors are no different from anybody else. They're human beings, and they don't change their ways real fast. And sometimes it takes a whole generation. So there's just more evidence building, more evidence, more education. And there's been a noticeable shift in really the last 5 years. How often a family physician will ask about vitamin D, check your blood level, and probably tell you should take 1,000 instead of 400. And gradually these levels are going to creep up, I think, to 5,000 over the next 10 years or so. And then the other problem, of course, is it's not a drug. You can't patent it. So the drug companies haven't jumped on it.
Wow. So yeah, there's not as much financial incentive to investigate vitamin D as there is financial incentive to investigate an antidepressant or an antipsychotic drug. That's such an interesting, point, and especially I'm very interested in nutrition and natural health and healing. And, one of the things that people say a lot is, where are the scientific studies to prove that broccoli is good for you? Or where are the scientific studies to prove that, you need certain vitamins or you need these things? And in a lot of situations, there's not a huge amount of scientific studies on nutrition.
True, but there's also a lot more research than you might think.
It's just maybe kind of kept under wraps or not brought to the forefront, brought to people's attention.
So I belong to a Life Extension Foundation organization, lef.org, and I get their magazine, which is Life Extension. And they're handy because I can actually order my own blood work. So if I want to check my vitamin D level, I order a vitamin D test from them. I go to the lab, and the results come to me, and then I can take those results to my doctor and discuss it with my doctor.
Oh, that's really neat.
But they have tons and tons and tons of scientific studies they've collected together, and they write very solid, sound articles showing all kinds of evidence for all kinds of things, from broccoli to, resveratrol to curcumin to all kinds of supplements actually, in fact, have quite a lot of science behind them, more than you might think.
Very interesting. So maybe if we just take the time to actually look, then we can find that. Because, as you pointed out, the lack of a financial incentive for pharmaceutical companies to invest things like this, or, we certainly aren't going to probably see as many commercials about, hey, increasing your intake of kale and broccoli could help you with this. No, we're going to see an ad about, the antidepressant drug, or ask your doctor about this drug.
Exactly. But again, it's a matter of, as a human being, as a consumer, educating yourself, being proactive. There is evidence out there, and there is, in fact, a lot you can do for your health. And the medical profession, by and large, is kind of dragging its feet and always down-talking supplements and nutrition as if, doesn't really fix much of anything. But a whole other subject we could talk about is, which I'm giving a workshop on next week, is there's a guy who's got a nutrition-based and supplement-based treatment method for cancer that's very scientifically based. And he's got dozens and dozens and dozens of people with late terminal cancers documented by biopsy and MRI, including pancreatic cancers, alive like 15 years later.
Wow.
Which never, ever, 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 ever happens in conventional medicine, and doesn't happen just because it went away. And yet he's just been, put down and trash talked and misrepresented by mainstream medicine relentlessly. So there's a problem on the one side that the nutrition field maybe needs more data and more science, but there's a problem on the organized medicine side that was just basically a bad attitude problem.
Right. And, I think that the money incentive is probably a big part of it.
No doubt.
That there's just not as much money in trying to get people to eat better than there is in prescribing them a drug. In your personal practice as a psychiatrist working with patients, have you seen instances where improving nutrition was helpful, or have you ever recommended that someone take a vitamin D supplement, for instance?
Well, I've actually just done 85 vitamin D levels on inpatients in my trauma program, and I'll be writing that up for publication hopefully before Christmas. And they have like really, really low levels overall. So I'm just trying to build some data and start publishing some professional journal articles myself and start getting this into more regular practice.
Well, thank you so much. That is incredibly interesting. I want to thank you for tuning in today and for leaving your comment, letting me know if you get depressed during the winter months. Be sure to subscribe to Psychetruth so you can see all of our future videos where we'll be answering your questions and talking more about mental health issues. Please be sure to give this video a thumbs up if you liked it, and friend Psychetruth on the Facebook and Corrina Rachel on the Facebook, and I look forward to seeing you again soon. Thanks.